And I commend you on what you do every day, transporting our students safely to and from school. So what we're going to do is medication training. As you know, your responsibilities as bus drivers and monitors continue to increase due to the medical needs of the students that you are transporting. You quite possibly could be transporting students that carry emergency medications because they have medical conditions that are life-threatening. Those medical conditions could be diabetes, seizure disorders, and also severe allergic reactions. So we have to protect and make sure that students that carry those emergency medications have someone with them at all times during the school day that knows how to administer those medications. That's why you're here. Because the school day essentially starts when we pick those students up from their home, and it ends when we drop them back off in the afternoon. So we are going to quickly go through the medication training manual. It is a program that was developed by KDE, Kentucky Department of Education, the Kentucky School Nurses Association, and the Health Department. So it was a collaborative effort to make sure that there is uniform training throughout the state. And we're going to do the emergency medication training for you so that if you do have a student with one of those medications, you will know how to properly administer it. Before we get started, I need to make sure that everyone has a manual. Looks like this. And then everyone has a test booklet that's stapled. Okay. You do have side arms on your chairs that flip up that you can write on. So for this program, you have to take an open book test that is not timed. So my interpretation is that we're going to go through this booklet together, and you're going to take the test as I go through the booklet. Okay? I will try to refer to page numbers, but sometimes I do get ahead of myself. But I will guarantee you that if you just listen to what I'm saying, and follow along your test questions, you will be able to answer the questions without difficulty. You can miss up to 5 questions, and I think that won't be a problem. If you need assistance as we go through the booklet, raise your hand. If it's a question, I'll certainly try to answer it to the best of my ability. But I also have 3 helper nurses in the back, if you guys will raise your hand. They're going to circulate around to make sure that you're up to speed on what question we're on. If you have any question that you don't want to address to me, but you want to address to them, just kind of grab them as they're circulating the room. And we'll try to get through this as quickly as possible. Okay, so page 5 of your booklet just kind of talks about the acknowledgments that I already mentioned, how it was a collaborative effort. And what this does is reduces the school's liability, and it also reduces barriers that all students can attend school. It might have been in the past that students with certain medical needs were not able to attend school because we didn't have people qualified to take care of them. Page 8 and 9 just gives an overview. Also, too, I want to regress and mention the yellow highlighted information is good to know information in the booklet. You'll see as we go on, there is green highlighted information. That green information indicates possibly information that pertains to a test question. Okay? Keep in mind that I run 2 exams out of this booklet, so not all the green highlighted information might not pertain to your test, because I do have another test that I use this booklet for. But that'll also kind of help you if you need some additional clarification on a question. Okay, so again, back to page 9. It tells how you have to pass the open book final exam with the 85%. So that's why I said you can miss up to 5 questions, up to and including 5 questions. And then you have to do a return competency demonstration. So we're going to take the test together, and then we're going to break into groups. And we're going to circulate into 4 rooms that we have. The 4 of us nurses will be doing the return demonstrations where I have trainers where you'll actually be doing the hands-on demonstration to the emergency medications we're going to discuss. So it's kind of a 2-part thing, the test and the return demonstration. Okay, so page 11, this information, you'll see there's some green highlighted information, so we're going to start talking about test questions here. And there is a KRS, a Kentucky Regulatory Statute. It's a 156.502 that specifically tells about how the district will grant you liability to unlicensed school personnel, which is you, when you do accept this delegation. There's a phrase in there that refers to the Paul P. Covedale Teacher Liability Act, and that act states that the district will protect you if you've undergone this uniform training. So based on that information, you should have been able to answer question 1. Okay? Now that same KRS states specifically who can and cannot do delegation. I'm up here, as Sherry mentioned, I'm the district health coordinator. I'm a registered nurse, and the nurses that are helping us today are registered nurses as well. We have 14 nurses in our school district, 6 are RNs, and the remainder 8 are LPNs. According to that KRS, there's only 3 people that can do training to delegate unlicensed assisted personnel, which includes you, and that is an RN, a physician, or a nurse practitioner. Only one of those 3 people can do this training. So that's why I'm here today, and I have some of the RNs in the district helping us. Now, even though we're doing the delegation and we're essentially supervising you, I do not need to be present in the building. I just need to be available by phone. So I'm located at central office. You can call there, ask to speak to me if you have a question in particular. Tony, the secretary there, has my cell phone number if you need it. So I do not need to be in the building. But I do want you to keep in mind, I know you all drive to and from, usually a specific school unless you're a sub. Those nurses at that school, whether they're an RN or an LPN, certainly know those students much better than I do. So if you do have a particular question, I would urge you to discuss that student with the nurse at that school first, okay? They are really your best resource, but for the delegation and the training per se, I just am the supervisor and need to be available by phone. And I will certainly help you or get the information you need when you need it. Okay, so just so make sure everybody's getting the hang of it. Everybody up to to question 3? Okay. Okay, pages 12 and 13 in the book if you're following along with the manual. These pages give you the information that you need to attend this training annually, every year. So for many of you, this is not your first medication training. Starting in the 2010-2011 school year, this was mandated that we have this specific training. So it's only valid for the current school year. This school year starts July 1st. So we already trained a group of bus drivers, monitors that were driving for the extended school year program the first week of July. So that's why you have to do it each year. Page 14. That's actually where the information is about it's only valid for the current school year. Page 14 also discusses the confidentiality and privacy. So if medical information regarding a student's needs is relayed to you, you just need to keep in mind that needs to be kept confidential. School records and any health information is protected under FERPA, the Family Educational Rights and Privacy Act. It's similar to what HIPAA is that you'll find in the medical community. I know lots of times when you go to the doctors, you have to sign that HIPAA release. We work under FERPA in the school system. And that means information that you are given about a student is shared on a need-to-know basis. So we feel as bus drivers, you do need to know if you have a diabetic student on your bus, because if they become unconscious, you need to know quite possibly why they might be unconscious. Okay? That information should not be shared with anyone else unless they too need to know it, like your monitor, so on and so forth. Page 16 and 17 just goes through some more specific information about changes in medications, field trips, and medical authorizations. That's information that really is something you as a bus driver monitor. You do not need to know that, because the only thing that children will be carrying on the bus to and from school is one of 4 medications. They're the only 4 that we allow students to self-carry on during the school day. It's the EpiPen for the allergies, it's the Diastat for seizure disorders, it is the glucagon for diabetic students, and inhalers. Okay, those are one of the only 4 medications that they can carry and possibly self-administer. But we do need to have certain paperwork on file at the school for students to do that. So you're going to kind of skip through the book quite a bit because you don't have to worry about routine medications. And we're going to jump to page 35. Yes, question in the back? One of them? Okay, they're coming. Okay, so we're skipping through the book because other school staff need to know about routine medications, pills, liquids, ointments, things like that. You don't need to know that. Like I said, you're only going to worry about these 4 medications that I just discussed, which we call emergency medications. So we're on page 35, and then the material starts on page 36. So as I mentioned, medication that is used for intervention in life-threatening situations can be one of 3 emergency medications: the EpiPen, the Diastat, and the glucagon. That's a true statement. Our school district, we throw in inhalers also because we do allow students to self-carry those. But for the purpose of question 6, refer to the 3 emergency medications: EpiPen, Diastat, and glucagon. That's a true statement. Does that make sense? Okay. The first emergency medication we're going to discuss is glucagon. That's a medication that diabetic students with diabetes might carry. If a student is a diabetic, that means they're not able to produce insulin. Insulin is used to utilize carbohydrates for energy. So if they have diabetes, they're not able to produce it. One of the biggest concerns we have for these students is low blood sugar, also known as hypoglycemia. Now, many students can feel that their blood sugar is getting low, and especially students that have been diagnosed for quite some time know what measures to take. They test their blood sugar, they know what their normal numbers are, they'll get something to eat or drink. Our concern is that their blood sugar crashes so low that they become unconscious and they are unable to take any food or liquid by mouth. So that's what this emergency medication is used for. Students will have high blood sugar, but hypoglycemia is one of the most frequent complications that we do see. And usually we're able to intervene before it gets to an emergency situation. Page 36, there's numbered 1 through 7, gives you things that might cause hypoglycemia. They could have received too much insulin by mistake, not eaten enough carbohydrates, or have a delay in eating. Physical activity can reduce blood sugar. For that reason, we ask, especially in the elementary level, and we hope in the middle school and high school level, that all students test their blood sugar before they are dismissed at the end of the day to get on the bus. That gives us guidelines to make sure that their blood sugar is within normal limits, that we don't have to worry about them dipping down to hypoglycemia on the bus ride home. So kind of keep that in mind. I do not know in my 7 years in the district any time we've had to give glucagon on the bus or in school. So kids kind of get a feel for their body. They know when they're dipping, and as long as they can take something by mouth, we don't have to give them this because it is an injectable, so it's only given when they're unconscious. Is everybody up to question 10? Take a minute and I'll let you catch up. Everybody okay? Okay, so I mentioned this glucagon, it's an injectable because they're unconscious, right? And they're unable to take liquid or food by mouth. Page 38 in your manual gives you the step-by-step guidelines on how to administer this medication. Actually, we're probably up to question 13 with all the information we've discussed. Okay, so the step-by-step directions on how to administer glucagon. We need to make sure that we have someone call 911 anytime an emergency medication is administered, the diastat, the glucagon, or the EpiPen. We want the EMTs to be there as soon as possible, and that is a district policy. So before you administer any of those medications, we need to, and with the bus, with transportation, it's a little bit different in the school system. They designate someone to call 911. It's going to depend on your situation. You may or may not have a monitor on your bus to assist you with this. You may or may not have a cell phone. But you all have radios that you can call the transportation dispatch. So based on your circumstance, your situation, we need to make sure 911 has been called and that we do have the EMS on their way. So that's always the first thing you need to keep in mind. And then you have to adapt it depending on what your particular situation may be. This medication is unstable. So it comes in a red hard case. The student's name will be on the outside. And if you're aware that a student carries any of these emergency medications, you need to know where they keep it at. If they're going to be unconscious, right? So for transportation, what we do, and you're all probably very familiar with them, we give you red folders. That red folder has information in it that gives you the information you need to know about students on your bus. Is everybody pretty familiar with the red folders? They have a piece of paper in it that gives the student's name. We give them the address, phone numbers of parents, whatever their guardian contacts are. And it gives you the emergency action plan that you would do in the event that this student would have hypoglycemia, for instance, for diabetes. At the top right, there is a statement and a checkbox. Yes, this student carries the medication. If that box is checked on that paper, that means that your student has that medication on their person. So we've been told by their parents. That's the problem with self-carries. We cannot make sure that happens on a daily basis. So I urge you that if you get a paper that has that indicated on it, yes, that student self-carries, that you find a time when you can confidentially ask that student to confirm where in fact they do carry it. And actually put eyes on it so that you know what it looks like, even look at it, because some things you might need to know the dose for. So keep that in mind. Now you might get that paper and that box is not checked. That's just so that you know that you have a student with that health condition on your bus, and we want you to know that, of course. That student might have the emergency medication at school, but they are not going to be carrying that on the bus for you to administer. But at least that gives you another piece of information in the event that that student would have some sort of medical situation occur while they're on the bus. Okay? So, as I mentioned, this medication is unstable. It comes in a red hard case. The student's name will be on the outside. And you need to know what dose to administer these students. That information also will be on the label. It comes with a vial. Can you still hear me? Okay. Okay. It comes with a vial of powder, and it comes with a syringe full of saline, 1 cc of saline. And you have to mix the two together so that you get the medication. As I said, the step-by-step diagrams are on page 38. You will be practicing with trainers that are in the white cases. They don't have live active needles, trying to protect you. So what you have to do is take the cap off the vial of powder, and the powder is very finely compressed. It almost looks like a tablet in here. And you have to take the cap off the needle. Dee, do you mind coming over? And you have to inject all the saline into the vial of powder. Regardless of what the dose is indicated on the outside, all the saline has to go in the vial because you have to make it the right dilution, right? Then you have to just gently shake it, hold it together as a unit. Some people turn it upside down, and if you don't hold that vial, you could quite possibly fling it and crack, and then you wouldn't have your medication. So once you've made it the right dilution, you now need to know what amount to withdraw from the vial. You're going to know that because the information is going to be on the outside, correct? There's only 2 doses, a half of the dose or a whole dose. And there's only 2 markings on the syringe, along with a lot of other writing that makes it very difficult to read. So when you go into your return demos, you'll be looking at an actual glucagon so you can see how the syringe is marked. So based on what the dose is, you then hold the vial upright in the syringe and you pull back the plunger to the amount of dose you need to administer. Your trainers do not have these markings on them, so when you do the return demonstration, just pull back. Make sure you hold it upright, because if you would be withdrawing your saline like that, or withdrawing your medication upside down, you have to keep in mind there's just a very little fluid in there, and your needle would essentially be suspended in air. So when you pull back the plunger, you're going to get air in your syringe, correct? So make sure it's upright. If you see that there's a large bubble in there, push all the medication back into the vial and start over. Be more conscious of how you're holding it. The bubbles, the little bubbles, don't hurt the student. The big bubbles displace medication with air, so they're not getting the amount they need. So that's why you need to make sure that you don't have a large air bubble in that syringe. If you're giving the whole dose, you might even need to pull the needle down into the neck of the vial so that you can suck all that liquid into there, because you're going to have almost exactly the right amount you need for a full dose. Okay? This can be injected into the arm or the leg. The needle is tough enough to go through clothing. I recommend everyone just think about administering it in the leg, because that's where the EpiPen goes, and I don't want you to have to think at the last minute, oh my gosh, where does this go? The leg is good. Inject it into the leg at 90 degrees, and you have to push the plunger. When you go to inject it in, I recommend you hold it like a dart. Keep your finger off the back of the plunger, because it's quite possible that you'll push the fluid out before you actually get it into the leg. So hold it like a dart, inject it, and then push the plunger. And if you need 2 hands, use 2 hands. After you have administered it, you put it back into the case. Don't worry about recapping the needle, because that's when most needle sticks occur. And you give it to the EMS when they arrive. Okay. The bus is a little different surrounding. The best positioning for a student when you give them this medication is on their side, laying down. So if you can accomplish that feat while they're on in the seat of the bus or on the aisle, the theory is that 90% of the time when they come to, they're going to vomit, and you want to make sure they don't aspirate. So have them on their side if possible when you give them this injection. So any questions about the glucagon? Everybody, are they up to 13? Question 13? Raise your hand if you're having a problem, and someone will come over and assist you. Okay, the next medication we're going to talk about is epinephrine. We call it an EpiPen, and it's used for severe allergic reactions. It, along with the glucagon and the diastat, like I said, according to that KRS, we have to make sure there's one person available at all time to administer that. So that's why you're here. You're responsible for students on the bus. Something else with a medication that's self-carried. You know, when we have medication in the school, we can check when the expiration dates are. We have them in front of us to look at on a daily basis. It's another reason why you need to look at the medication that students might self-carry, because we don't see that. Health services quite possibly might not ever see that medication that they self-carry. So you need to see what the expiration date is as well. We notify parents 1 month prior to an expiration date to try to give them the time they need to get that medication filled at the pharmacy. That's not your responsibility, but you could tell health services that you have an issue, and we will try to get that replaced. Okay, so question 16, are you able to answer that? As I mentioned, one of the first things we do is dial 911 whenever we need to administer an emergency medication. Okay, the EpiPen. It's used for severe allergic reactions. Those allergic reactions can be to food, it can be to medicine, it can be to insect bites. One of the biggest things we have students carry EpiPens for in the school system is because they have peanut allergies. And I know kids aren't supposed to eat on the bus, but we will have parents that will have students self-carry because of their peanut allergies. It's a very frightening thing for both the person with and the parents of a student that has a life-threatening allergic reaction. Page 39, the bulleted areas there gives you the different degrees of signs and symptoms you might see for an allergic reaction. It can be as minimal as itching and hives. It can progress to swelling of the lips and tongue. And then, of course, the most life-threatening is when it affects the respiratory system. They become hoarse, cough, gasping for air. So page 40 gives the step-by-step directions on how to administer an EpiPen. Once again, the first step is to call 911. And it's extremely important for this medication because it's a unit dose medication, so a student's response to the medication is very individualized. And based on that, the effects of the medication may only last 10 to 15 minutes. It is dispensed in a 2-pack from the pharmacy, but you need to keep in mind that oftentimes they will only carry one at a time. You know, parents with students with allergies need a dose of medication at various different locations, grandma, grandpa's house, school, daycare. So oftentimes we find they'll split that pack up and will only have one, which makes it even more important that you call 911 because it might only last 10 to 15 minutes. Their symptoms might improve and then they might be having a regression where they're once again having difficulty breathing. So you do want to make sure 911's on the way. So, step-by-step directions. The manual has an older version of an EpiPen. Many of you might have seen that in the past. It's got a gray and a black end. They've kind of been phased out. And we're seeing the EpiPen that Dee has here. Comes in a hard case. You flip open the green case, drop the EpiPen in your hand, and it has an orange and a blue end. If you need to review the directions, they're on the outside. Okay. Now, only one end of this can be removed. The orange end you cannot pull out. You're only able to remove the blue end. So you remove the blue cap. At that point, it's activated, so you need to make sure that your next movement is to inject the student. So you take the EpiPen, wrap your thumb around your fingers. You do not want your thumb on the end of the device in case you get the ends mixed up. You don't want to be injecting yourself. Put your thumb around your fingers, and then you stab and jab in the leg. You hold for 10 seconds, inject it at a 90-degree angle. When you remove it, you lightly massage the area and put it back in the carrying case. Give it to the EMS when they arrive. This projects quickly, and it will go through clothing, blue jeans. Recommended site is the thigh. So like I said, those KRSs that we mentioned, they allow students to self-carry and self-administer this medication. Now, I find it unlikely that a student that has received an EpiPen once wants to get an EpiPen again. So I would think that the chances would be unlikely that they would self-administer it. But, you know, you have to think there's plenty of people out in the public that are carrying that. They have a bee sting. They're going to inject themselves. But for students, we need to make sure that you're trained to inject it as well. So take a minute and look over your test questions based on the information we just discussed. You should be able to answer up to and including question 26. So take your time to catch up. Just look at the questions. We've discussed everything. If you need review of something, raise your hand. Everybody good? Thank you. There is another EpiPen that has recently been on the market. It's called an AviQ. And we're seeing students at the end of last school year that started carrying this medication. We're going to run through it now, and we'll also run through it during the return demonstrations. But it talks to you. You don't have to remember anything. It's really cool. So Dee will run through it. Okay.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and 5, 4, 3, 2, 1. Injection complete.
Isn't that neat? It's like an AED machine. It talks to you. And there's only one black end, so you can't get it wrong. Okay. It comes in a 2-pack as well. Once again, can't guarantee that a student will have both of them on their person. But the reason why it comes in a 2-pack, as we mentioned, you might need to administer that second dose in 10 to 15 minutes if their symptoms are not improving or they again worsen. Okay? All right. Okay, the next medication we're going to talk about is what is used for seizure control. And the name of that medication is Diastat. The medication itself is diazepam, which is a rectal Valium. And you need to keep in mind, we can't put anything in a student's mouth that's having a seizure, right? So this is really the only portal of entry as a rectal gel for this medication to be administered. There's a few things you need to know about seizures. Students will not always lose consciousness when they have seizure. We're on page 41. The bulleted items there gives you the different types of seizures you might observe. They can be minimal. It can be staring and blinking of the eyes. It can be jerking on one side of the body, and it can be a more generalized movement of the entire body. On the bus forms this year, we are trying to indicate to the best of our ability what type of seizure disorder or what type of movements a student might have. Sometimes students might have, or a student might have a seizure on the bus that it's the first seizure. You're not aware that they have this seizure disorder. You don't have any information in the red folder. A student having a seizure for the first time is an emergency situation. You would call 911. If you are aware that they have a seizure, and we know that there's medication that's ordered for it, and you have it on the bus, we don't call 911 immediately. It's not considered an emergency situation. We wait until the medication is administered, or shortly or right before it's administered, to call 911. Now, I know it's a perplexing situation. Everybody has the instinct to immediately call 911. What I would recommend is that at minimum, you at least notify transportation what's going on your bus, and of course pull your bus over. I've also discussed with Sherry that we need to make sure that these students aren't going home to an empty house or to a parent that's not aware that their student has had a seizure. So let's say you have a student that's had a mild seizure on the bus, you don't administer the medication. We need to at least make sure that there's been a phone call home and we have permission to drop them off. Because if they are having one seizure, the possibility of them having another one is great. So we want to make sure that there is someone there to oversee them. So that is also part of the emergency action plan that is indicated on that bus form that you'll have in your red folder. So as I mentioned, not all seizures are an emergency, and we don't administer Diastat immediately. This medication, in most instances, is ordered to be administered after a seizure has lasted 5 minutes. We do have a few students in our district that do have it ordered to be administered immediately upon a seizure. And that's because their medical history proves that once they have a seizure, they're not going to stop with some sort of medical intervention. So there are a few. Once again, that will be indicated on the bus form that you receive. And it also will be indicated on the outside of the box the medication comes in. Another reason to see what they're carrying. Put your eyes on it. Seizures can last from a few seconds to a few minutes. So the first thing you need to do is to time a seizure when it begins so that you know, of course, when that 5 minutes has elapsed to administer the medication. As I mentioned, you don't put anything in a student's mouth when they're having a seizure. You don't try to hold them down. You don't try to restrain them when they're having a seizure. This medication, as we mentioned, needs to be administered rectally, so confidentiality and privacy for these students is of utmost importance. And I know how difficult that would be on a bus. It might reassure you to know that I don't know that this has had to be administered on a bus before. Okay. So if you have a monitor, of course that would be optimal. They can help control the other students. You can't really move the student that's having a seizure. You can have them lie on the seat, but you can move the other students to as far away on the bus as possible and have them turn their back so that they're not viewing the administration of this medication. Because of the exposure factor that's needed to administer this, we find that oftentimes parents will elect for us to have this medication at school, but not on the bus. But if we know they have a seizure disorder and they do have the medication ordered, we'll still give you information for your red folder so you know what's going on. Placing these students on their side is the best position because 99% of the time they too will vomit after they come out of that seizure. And oftentimes they will be incontinent, which means they're not able to control their bowel or bladder. So another reason you really want to try to protect the privacy of these students. It's very embarrassing for them, and it's scary for the other students on the bus to see the seizure activity. Page 43 gives the step-by-step directions on how to administer this medication. So as I mentioned before, a seizure is not considered an emergency if we know they have a seizure history. But it is considered an emergency if it lasts longer than 5 minutes, if they come in and out of seizure activity, which means they might have a seizure for a minute, they stop for 30 seconds, and then they have another seizure. That is an emergency situation. I already mentioned if they have a seizure for the first time, that's an emergency. If, along with the seizure activity, you find they're having difficulty breathing, if they become blue around the lips, or you see that they're gasping for air, of course you want to call 911 immediately. And if a seizure occurs in water, that is an emergency situation because we're concerned of them aspirating fluid into their water into their lungs. So that information will help you answer question 35. Okay, so the Diastat comes in a 2-pack as well, but once again, you might not have both of them on the bus with you. For the same reason, they need numerous supplies. The directions will be on the outside. For instance, this one says, give for seizure over 5 minutes. This is called an AccuDial. The pharmacy has been told by the physician what amount of medication to dial in the syringe, so you don't need to worry about the dosage. But depending on the dose, the plunger will be out perhaps just a little bit, or it might be out a little bit longer depending on what the dose is, but it's already predetermined. You'll see a green ready band on the top, which means it's ready to administer. The box comes with a packet of lubricating gel. It does not come with gloves. Health Services puts gloves in this box of medication for personnel to use. Once again, we don't see the actual medicine that kids self-carry. Another reason to look at it and make sure there's gloves in there, or at minimum, make sure you've got some gloves on the bus with you. Okay? So you have a student having a seizure. First thing you do is time it, right? Step-by-step directions are on page 43. You can go ahead and call the bus garage, tell them what's going on. Hopefully you've got a monitor to help you assist with the other students. And actually you just have to wait until that 5-minute mark approaches, which I know seems like an eternity. Around the 4 minutes, I would certainly by that time have gotten the medication out. I would do that initially when a student has a seizure. I would start looking for that medication after you start timing it to make sure they have it with them. Get the medication out. Go ahead, put your gloves on. Open up the lubricating packet. Take the cap off the medication, and you lubricate the tip. That's to help with the insertion. Of course, you've removed that student's clothing so that the rectum is visible. If you have them on their side facing you, that's the best position. I know you're not going to have a lot of room on that bus to begin with, but facing you is best. Bend that top leg, and you have to insert the applicator into the rectum, and then you slowly squeeze the plunger for a count of 3. If it takes longer than a count of 3, that's fine, but you don't want to do it quicker. You want to try to insert the medication slowly. Once the plunger is pushed all the way in, you hold it there for a count of 3. Then you remove it and you squeeze their butt cheeks together for a count of 3 to help them retain it just a little bit longer. The mucous membrane in the rectum is very permeable to medication. It transfers through the cell membrane very quickly. Same thing with nitroglycerin. That's why you put nitroglycerin under your tongue, is because medication gets through those cell membranes, the mucous membrane, very quickly. We can't put anything in their mouth. This is our only mode of medication, way to administer medication. Okay. Yep. So, page 47 just talks about local school districts' policies and procedures. We do have those policies and procedures available for you to view if you have internet access on the Kenton County School District's webpage under Health Services Department. I do have the manual and a PowerPoint presentation that goes over some of our policies and procedures. I will tell you the manual looks a little bit different than what you're viewing today because it has been updated. Because I've incurred the cost of printing all these manuals, it contains the same information, so the manual will be a little bit different. Yes, Charlotte?
Paula, I know the diastatus, we have not administered it on the bus.
Right.
How often do y'all have to do it in the school?
There's school years that go by that we don't administer it at all in any of the 18 schools.
Okay. That's why I wanted everybody to know.
Yeah. It's rare that we use any of these, to be quite honest with you. But that one time that we do need to do it, we want to make sure everyone's prepared. And that's why we do it annually, because very few, if any, will use this information. So if you don't use it, you lose it, right? So we have to go over it every year. So, has everybody been able to answer all 35 questions? Anyone need some clarification on anything? Because you will be grading your own. And remember, you can miss up to and including 5. So I'd rather answer a question now so you get it right. Otherwise, you have to go through this again. Okay. First thing, I want everybody to take a minute and put their name on the top of their test.
And if y'all want to get credit for it, you want us to be able to read it. You might have to print.
Okay, so we're going to run through grading these real quick if you'll follow along. Put an X over the number if you've gotten it wrong. There's definitely a pattern. I rearranged these test questions to follow the booklet. So 1 through 5 is A. And in fact, 6 through 9 is also A. Like I said, when I rearranged them, it definitely made a pattern. 10 is D. 11, D. 12, 13, 14, and 15, A. 16, B. 17, A. 18, D. 19, C. 20, D. 21 and 22, A. 23, C. 24, B. 25, A. 26, 27, and 28, B. 29, 30, 31, A. 32, A. 33, B. 34, A. 35, G. Okay. Now, please help us make our work a little bit easier because we have to document and I have to put all this information on an Excel sheet. Put the number you missed wrong at the top, -0, -1, -2, along with your grade. If you missed 1, well, of course, if you missed 0, you got 100. You missed 1, you got a 97. 2 a 94, 3 a 91, 4 a 89, 5 and 86. Okay. So, we're really moving right along here and on time. I think the plan is to give you a 15-minute break, but it's my understanding you're going to break into 3 segments, and I don't know if Tina has a way she's going to break you up or not. But you're going to be hitting a session that is a return demonstration. So the 3 emergency medications we just demonstrated to you, you're going to return a demonstration to us. I want you to keep your test booklet, your manual with you. And when you go to that return demonstration location, which we've got 4 rooms set up, we will collect that information. Please do not walk away with the test booklets or the manuals. We will track you down. Okay? So, thank you for your time. Once again, I appreciate all you do for our school district, for our students.